Looks good. Okay. Well, welcome back. We are live with Ken Woodruff from Lexmark. And at HIMSS, everyone is talking about electronic health records, electronic exchange. What does a printer company have to offer for this?
Yeah, well, interestingly, we find ourselves right in the heat of the action here because as organizations switch from paper to the electronic records, we find that there are a lot of new requirements. In fact, one of the hottest issues is how do you deal with network and system downtime? So one of the things we're showcasing here is a unique downtime report printing solution. It's the first printing device that has an embedded downtime report printing application that comes right with the printer or the multifunction device.
Okay, so instead of advertising for systems that are up 100% of the time, you're kind of taking advantage of that inevitable downtime. What so I know I work in an all electronic emergency department, but yeah, occasionally we have downtime and we break out these boxes of like old forms, and this is, I guess, how they used to do it in the 90s or something. But what does Lexmark have to offer instead of those boxes?
Okay, well, what we have is a solution that allows you to print what you need during the downtime on demand, right from the device. I mean, we've seen the boxes, break out the forms and to go back to the old way of doing things and so forth. But what we find is that it can be sort of a complex process. It doesn't happen very often, so there's a big training issue. So what we've developed is a solution around our unique touchscreen devices. We have this user-friendly touchscreen, simple one button. So there's a big button on it that says downtime reports. And so I'm working in a hospital system. I've learned the system's gone down. What do I do? All right, well, all I have to do is walk up and press the downtime reports icon, authenticate if I have authentication, and I'll see a list of the content that's there to be printed. It might be, physician census, medication administration record, or there'll be a category for blank forms because, as you say, you may need to go back to documenting something on a piece of paper that's important to know while the system's down.
Is this something that can last for days, or just designed for hours, or whatever's needed?
In theory, I guess it could last for days, but you would hope that the system's not going to be down. Although we did have one hospital while we were in the middle of installing solution was down for actually 5 hours. The system, so it can be a problem, but most of the time there's certainly a lot of focus on trying to keep the systems up, but 365 days a year, 7 days a week, it's tough in a hospital.
It's inevitable.
Yeah, it's inevitable.
Interesting to see that you've ventured out into healthcare and electronics. Tell us more about that.
Yeah, well, we've got two divisions in Lexmark, and the Printing Solutions and Services division focuses on the business enterprises, and we've had a vertical focus, from day one since we were spun off of IBM. Healthcare is one of our key verticals. We've been focused on the healthcare industry for going on 16 years now. If you look at where we started, prior to becoming an independent company. And we've learned a lot, given that we're right in the heart of everything that's changing in healthcare with the paper-based process. And so, that's led to some of these innovative solutions, such as the downtime solution, which is just one.
Yeah. And you were telling about this touchscreen interface. Is that, is that a proprietary system, or is that something that like any hospital could adapt?
Oh, sure. Any hospital. It's not proprietary. It's really just a icon-based touchscreen. So you walk up to this device and you see icon buttons. Okay, a standard multifunction device, you'll see things like copy and fax, what you'd be used to. But on one of our systems, in a typical clinical setting, you might see the button for downtime reports. You might see a button for forms on demand. You might see a button for scan to medical records, because you can use this as an on-ramp scanner. So it's to bridge that gap between the paper and digital world.
I see. And it's like, so I'm trying to, again, imagine my department, and we all have these network computers, but you're envisioning just a computer that's kind of separate from the network, because the rest of the network is probably down. Is that
Yes. This device lives on the network, these multifunction devices, or we have a printer that has a touchscreen as well. And it's typically the all-around network printer for anything that does need to be printed. But while the network is up, we store the downtime documents. That's an example. Now, there are other solutions as well that play very well in this new world of healthcare, particularly as you move to things like mobile devices, tablet PCs. How do you print from one of those, right? Yeah. So we've got a great solution we call mobile print release that allows a user to basically walk up to any device and release their print job. So the job
is that like through Bluetooth?
No, it's not through Bluetooth. The print is done, instead of to a specific device, it's done to a hold print queue. Okay, and when the user's ready to release the job, they simply walk up to the device, press the print release button. They'll be asked to authenticate. Of course, we can set this up to work with a proximity badge or that sort of thing, so it's easy. And then what they'll see is a list of the jobs that they submitted to print, and they can check the ones that they want to print and print them immediately right there. Or, we've found in using this that many times you find that you print something and you forget.
Oh, you can't imagine where.
You forget, I really don't need that, and so you don't print it. So one of our key value props is that we have solutions that help organizations to print less, because certainly in this world of digital healthcare, there should be a lot less printing, right? But we find that
that hasn't been the case.
Yeah, it hasn't been the case, right? It's default not the case, but with our solutions, we create an environment so that you can, cut that safety net to paper, right? Only print what you need when you need it, and don't just automatically print things just because you want to have that backup copy laying there.
Wow, is that maybe hurting your core business?
No, well, we don't think so, because we're it's no secret that we're not number one in the market, right? So it's a win-win, right? So we can come in, as the guy with the lower market share, and optimize the environment, take to the right number of devices, and significantly reduce output. So, for example, the Detroit Medical Center, we've got a great testimonial there where in their first year with Lexmark said we reduced our printing by 25%.
That's something.
Yeah, I think this paper savings alone was over $100,000, $200,000. So.
Wow. Lexmark working to reduce printing. That's the headline from today.
You sort of answered it in a way. I mean, the question was how does this work with existing devices, and functionally, like, what do you do when you have your EMR now on your iPad, or if people get that way, if they do that, what did you walk up to the printer, and then how does it interface with each other?
It would be a print just to a print queue, just like you're normally printing to a network device. And with the print release application, that print job is not immediately sent to the printer from the queue. It's held there until the user walks to the device where they'd like to retrieve their print job, and they're able to initiate the release of that job to the device where they're standing at the time. So it solves that. We call it the print anywhere feature, right? So you imagine a hospital campus where these devices are located around the facility, and so you just walk to the one where you want to retrieve your job, click the button, authenticate with your badge or whatever method you use, and out comes your job.
Do you have anything on display for us at HIMSS this year?
Yes, we do. We have a booth 8215, and we're showing our downtime solution there. We're also showing the savings opportunity around optimizing a fleet of output devices. Yeah, it's very interesting. I mean, we've done studies. We took 36 of our in-depth print studies and ran the numbers, and we found that the average healthcare organization has 74 unique models from 10 different manufacturers. So yes. Yeah, so you look at the duplication of maintenance contracts, consumables, and obviously you can't aggregate your consumable spend with all these discrete devices and so forth. So by optimizing, we've cut numbers of devices by as much as 70%, and cut output costs by up to 50%. And to give you an idea, we're talking to a gentleman yesterday, so he's got 535 bed facility. So given the metrics we have, we plugged in the numbers, and we said, well, you're probably spending about $1.4 million every year on output. That's a stack of paper. I don't know how many miles high. We calculate that and put it on the screen. And he said, well, interesting enough, we have done an analysis, and our number was 1.6. So we can nail it pretty closely as a starting point. But that's the other thing we do, is to help organization right size, because you don't need all of these devices right as you move to the digital world if you implement a strategy like we're talking about, where you give easy access these solutions like the print release, the downtime report, so you only print what you need when you need it.
So we're with Ken Woodruff from Lexmark